All right, hi everyone. It is now March 21, and so it's been 2 weeks since we went on lockdown in Seattle. Not exactly lockdown and very voluntary, but I've got some information and some data to show you about what is going on here in Seattle. And I want to compare it to what's going on in the U.S. around the nation. Again, usual disclaimer, this is me looking at the data. All opinions are my own. The data is publicly available, and I can only trust the data so far as I can see it. But this is what I can see in the data, and it's an important point for us because it's 2 weeks after at least my university, Seattle Pacific, closed, and all the other universities as well. Now I want to show you the conclusion slide first. The main thing is, I've said before that we in the U.S., we want to follow South Korea's trajectory. And clearly we want to avoid the healthcare crisis that is happening in Italy right now. So how do we do that, and how are we doing now that we look at these data? So the Seattle area actually looks like South Korea so far when you look at mortality data. Again, a lagging indicator, but at least it has some certainties in ways that confirmed cases do not have certainties. That's good news. The news for the U.S. as a whole is not so good. We are still closer to Italy than we are to South Korea in terms of this mortality rate. There's many other factors to consider, but I want to show you what I mean when I say that right now the rest of the U.S. looks more like Italy than South Korea. Now, keep in mind there's many things that we cannot control. We can't control age demographics. We can't control the nature of the way that this disease was introduced. I think it's very important how the disease is first introduced and maybe even the age range of the people through whom the disease is established. The one thing we can control is we can control how far away we are from each other. And so that's my main message that I want to get across right here. It looks like social distancing is helping in Seattle, and I want the rest of the nation to highly, highly consider doing it and not expect things to change tomorrow, but look back in 2 weeks. This is what I ended the last talk on. We look forward by looking back at the previous cases. Each wave of disease took 1 to 2 months, and it will take 2 weeks to see the fruit of any distancing that you do today. And it depends on whether you're looking at cases, hospitalizations, or deaths as to when you expect the social distancing to have an effect on those. We've got to be patient, and we're not set up as a society to be very patient right now. And it's very hard to be patient when most of us are told to go home and either work the hardest we've worked in our lives if we're in the healthcare industry or one of the support industries, or we are told to sort of wait and support the other people who are working so hard. Is it really worth it? It looks to me like from the Seattle data that it is, and the kind of voluntary social distancing that we've had with some legally mandated parts, but actually mostly voluntary social distancing, can actually get results if you do it enough, like we're doing it in Seattle. 2 weeks ago today, my university had just announced 15 days ago that we were not getting back together for classes for the rest of this quarter. We went online, and actually we've been able to cope. We've been able to do most of the things that we need to do through a computer online format. There's been an aggressive voluntary work from home movement. Many of the corporations in Seattle have started off by encouraging everyone to stay and work from home. And now it's moved to, in many cases, mandatory. I have some friends who are Snohomish County residents, and so I've been able to keep up with them. My friend who works for an area company or an area institution was basically told everyone needs to be working from home now. Is that having an effect? I believe the data shows that it is. Now remember, this is the thing that I see over and over again, so please look for these important things about the data. Cases confirmed depends on how many tests you've done to confirm the cases. We have not done enough tests, and so we cannot rely on this for certain predictions. For other things, it is very reliable. If you want to know whether you should quarantine or not, get tested. You'll see if you have the virus in you right now. But for an overall measure, it's all we've got in many cases, and it's fast, but it's not necessarily reliable. The ultimate indicator that we need to look at is deaths. That is the irreversible of all irreversible indicators, humanly speaking. These take place weeks after infection, though. And so that means that they take place weeks after any social distancing done to reduce infections. And so you won't see results from social distancing in the deaths right away. The crucial key in all this is critical care capacity in hospitals, but there's many reasons why that's complex. The good news is one of our area counties is actually reporting on this very number, and I've been collecting that number, and I want to show it to you. The other thing that I talked about in a previous episode, if you want to call it that, is how we had two Italian provinces that had actually, one had an earlier introduction of the first case of coronavirus in Italy, and it immediately implemented some pretty severe social distancing, probably similar to what we're doing in Seattle right now. The other one did not have cases at first, slowly got cases, and only implemented distancing 2 weeks later. By then, it was too late to control the cases that were already on the way. Remember that the one that distanced 2 weeks after, that saw that its cases were flatter than the one that didn't distance. Again, this is just two provinces. Have they been cherry-picked somehow? I don't really know, and how are these similar or different from our case in the U.S.? But the main thing that I see there is I see an exponential growth curve elbow that I said, this is what we need to watch for in the data. If cumulative data is flat, that means that it's going up, right? But it's not increasing in how fast it's going up. It's that elbow that's really scaring everyone right now. And so when we look at the mortality indicator for Seattle, I've collected these statistics as reported by the health departments over the past couple of weeks, since the 8th of March. And this is what it looks like. Definitely going up, right? Orange is Snohomish County, definitely going up. King County blue, definitely going up. There might be a little bit of an elbow there, but it's not a severe elbow. This looks more like a line, a straight line, than a curved line, to me at least. To me, that's good news. There's no elbow yet, and we're now 2 weeks after social distancing. I'm hoping that the measures that we've taken will continue to keep this at least linear, and will hopefully even straighten out this line a little bit more in the future. This is what I think is the really good news, and this is what I want people to know about. I've been watching hospitalizations for Snohomish County. King County does not report hospitalizations, but Snohomish County does. Now, Snohomish County, if you remember the numbers back here, Snohomish County has about, let's see, we've got about 1/10 the deaths, 1/10 the incidences of King County. So there's a lot of differences. I estimate that there's probably 1/5 the hospital space in Snohomish as relative to King. King is the big urban county, and Snohomish is smaller. And so the cases here are lower. We've got, back of the envelope estimation. I estimate that there's maybe about 100 ICU beds. And I saw this number sort of going up from about 25 when I started to look at it. It went up to about 60, above 60, on the 17th of March. And I was worried because you see how it looks like there's an elbow going up. But now look at what happened. On the 17th of March, since then, the hospitalized Snohomish County residents has gone up, but it's gone up by only 1. Right now it's at 65, and that was the data just reported like an hour or two ago. There's an elbow in this data, but it's a good elbow. It's an elbow that is curving down rather than curving up. Now remember, critical care capacity is a flat line up here. We have to avoid hitting that flat line. And we're still going up, so that means at this rate we will still hit that flat line. Also, these beds are being taken up when they need to be used by others. I'm sure that the ICUs in Snohomish County are pretty packed because you've got to have all these 60 extra patients on top of your normal load. But while difficult, it looks like it's the kind of thing that will actually not provoke a healthcare crisis. Lots of caveats I could say here, lots of things I don't know. But I do know that this number is not going up sharply. Let's hope and pray that it will start to go down in the coming days or weeks. The other data is that we can look at mortality by country. This is cumulative deaths, And there's 3 countries right here. I realize it's a little bit small. I've made these graphs in a hurry, so I haven't followed all the things I teach my students about how to make good graphs. Sorry about that, but I'll just explain it to you. Blue is South Korea cumulative mortality. Again, this line cannot go down. We want this line just to become flat. South Korea has kept coming up. By the way, I've been keeping an eye on the deaths in South Korea, and they keep creeping up. This is still an issue there, but it's not an explosive issue, at least as reflected in these data right now. Italy, on the other hand, you see how it shoots up on this. And the other thing I'd like you to notice, it shoots up beyond the top of the graph here. If you look at this graph, the USA was looking like South Korea, but then it started to hit an elbow, and deaths started to go up. And this is the country deaths. And by the way, this most recent point is a point I just got off of the Worldometer coronavirus page. This little gray dot, in my experience, will creep up a little bit even now. So this line is still shooting up, and the question is, how much is it shooting up? Is it going to look like Italy, or is it going to look like South Korea? And let me zoom out to show you all the Italian data. This is all the data, and you see that Italy has had their worst day reported just today of any other days as far as deaths in a single day so far. They've gone up by more than 500 deaths. So you see, this is definitely an elbow graph, and this is tragic, and this is a healthcare crisis. If you're wondering whether all this is worth it, when we look at Italy right now, and it's still getting worse in Italy, let me tell you, it's worth it to avoid this. Let's keep an eye on both of these countries as we move forward. And notice how our country is still down. By this measure, it looks closer to South Korea than Italy. But that can change quickly, because the nature of the elbow that we're worried about is that it grows upon itself, and it begins to accumulate exponentially. So there's another way. I wanted to see, when you're comparing curved lines, it's hard to compare exponential lines because they curve so much. So one of the things that you can do to straighten out an exponential line is to take a logarithmic scale. And so I got this idea from a chart, and actually I'll go back and I'll cite the site that I got it from, because I took my own data and I converted it to this chart. I was inspired by this other chart that I saw. But I saw a way to straighten out those curved lines so that we can actually compare them and say, okay, this is curving up. Is it curving up faster or more slowly than this other nation? That's what logarithms are good for. And so if you're curious how I did this, it's actually pretty simple. I just scaled it by population, and I plotted cumulative deaths on a logarithmic scale. And so that's why now you have the yellow line, which is the Washington, King County, Snohomish County combined numbers. They're so high because we have a high relative percentage of cases. We were the first in the country to be hit by this thing. And so we've had it for a longer time. And most of the country, a week ago, most of the country's cases were right here. That is no longer the case, and it's clearly spreading across the country now. The orange line is Italy, the blue line is South Korea, and the gray line is the U.S. as a whole. Because I've straightened out all these lines, we can now see it, and you can see that they're not perfectly straight lines, but I've eyeballed it myself to fit it to what I think the best straight lines are. These are always going to be straight and rising up. The question is, how much are they rising up? The more it's rising up, the worse the mortality increases, the worse the upward curve is. These are my own estimates, but I'm showing them to you because I'm saying, okay, if you don't believe me, these are the data. You can try to draw another line. Do you think you can draw a better line than that? Maybe you can, but I don't think it'll be significantly different in terms of the conclusions that I draw. So let me take away the data, and let me show you the yellow line for the Seattle area, the 2 blue lines that are South Korea's line. Oh, that's one more thing I should mention, okay? They don't always fit perfectly straight lines, but in some cases, I think that they fit 2 straight lines. And so it's kind of like there's 2 phases to the curve is what we call it, at least in chemical kinetics. I'm not sure if that's the right term. Like I said, this is an adjacent field, and I'm approaching this as a chemist, okay? But if I want to approach this as chemical rates, which actually works pretty well, then I want to say that I see one slope, like for Italy, you see one slope to the left and one slope to the right. For South Korea, again, you see one slope to the left and one slope to the right. For the U.S., I have two slopes. Again, that's complex, but I'll explain those as I go through. So let's compare the lines, and let's see which slope is flatter. The flatter slope, the flatter line, the one more like this, is going to be the better situation, less growth. So I've taken away the data. I'm just showing you the lines. Let's take Seattle's yellow line and move it to South Korea's blue lines. And you see right there, Seattle's line is pretty similar to South Korea's blue lines. It's a little bit, and I actually have that backwards. I'll have to edit that, but I can't edit it. So here we go right now. It's actually going to be, actually I have it right. It's slower than the early line, and it's actually faster than the late line from South Korea. And that's actually encouraging. Actually, what we're curious about is how slow or how fast it is. If we take the South Korea lines and we sort of average them out, then they come pretty close to the Seattle slope. And so it looks like Seattle is holding things down to be like South Korea. And in fact, if we take the gray USA line, if we take the one on the left and we put it in there, then we see that if we lift that up, that's actually about the other lines as well. There's a reason for that. Remember how that line early on is mostly going to be data from the Seattle area anyways. It's just scaled by a different population factor. If you're curious about that, I can let you know more about that, but that line is mostly influenced by the fact that all of the numbers were coming from Seattle in the first place. So that's old news. What's new news is the new Seattle line, which you see is definitely at more of an upslope than all of the other ones. So let's go back to the data again, and let's look at that later line. The mortality rate for the later line is faster everywhere else in the U.S. And I want to show you, if we bring that up to South Korea, it doesn't match those as well. It's on a higher slope. If we bring it up to the Italy line, then it's actually looking like the Italy lines right now. There's some reason for thinking that it's actually slightly flatter still than the main Italy line, than the early Italy line, which is the thing that we're really worried about. That's the hugely explosive growth. But it's still growing explosively. And let me remind you that most recent gray point is going to go up a little bit before my day is done. But I wanted to get this out here so that people know, A, Seattle appears to be working. B, the rest of the country needs to do what they can to be like what's happened here. So, it's 14 days after social distancing. You know, there was a zombie movie, 28 days later, and now we're at 14 days later. Thankfully, this is nothing like the actual zombie movie, but it's an interesting time scale because the time scale of viral growth is actually probably on the scale of weeks that we should be looking at it. So remember, Snohomish residents have been hospitalized. That number only increased by one resident for 3 days straight. I want you to know that. It looks like it's okay in Snohomish. And especially this is important to me. I know some people that are having those numbers, that are counted in those numbers. And I also know some people that are not counted in those numbers because the system has not caught up to them yet. Okay, so I realize that this is bigger than the data shows. But as far as the data shows for hospitalizations, it's only increasing by one. Let's get that down to 0. Let's get that negative. And then we can really say that we're dealing with this. Seattle does look more like South Korea than Italy, and let me say a critical care crisis is still possible. The lines are still going up, but they're going up less. I think the work from home revolution that we've had, canceling schools, I was skeptical when we first did it. When I'm looking at the data now, it really looks like it's worth it, both looking just at our area and comparing it to what's happening in Italy right now, which is really tragic. Another note is that demographics are crucial, and it's important right now to notice that Italy has some demographic extremes that are not true for the U.S. And not true for South Korea. There may be something in these demographics that will help us, but we can't control that. We're called to change what we can control. What we can control is how far apart we stay for each other for a couple of weeks until we see in the data what's going on. The other thing is that younger demographics may protect a region. And that's why actually, when I hear this, I think of Africa. Africa has very young demographics. And so I expect that if demographics are protective, it will really help Africa. USA is a little bit younger than like the UK and some of the other countries in Europe. It's definitely younger than Italy overall. And so that might slow down the virus a little bit, but we don't know for how much. We don't know where the tipping points and the elbows are out there. And I don't want to go into that blind. The other thing that I'd like to say, Iran has a very young demographic, and they're clearly struggling with this as well. Unfortunately, I don't trust the data from there, so I don't want to say how much the demographic is helping them. So in early April, basically I'm going to look at the data again, going to see what 28 days later looks like. One thing I can predict, it'll look a lot better than 28 days later the movie looked like. And by the way, biochemically, I just don't like zombie movies because they don't make any physical sense to me. I don't see how they could ever work with the atomic sort of mechanisms that we have for life. But that's another topic for another day. I think the time scale is a good thing, and let's look at this. We got to approach this on the level of weeks, if not months. I'm actually mildly optimistic from what I've seen that we might be able to deal with this on a week's time scale, but it's going to take that. So to the rest of the U.S., I want to say you have a choice, okay? You won't see the result for 2 weeks. And this is a kind of thing where you have to learn who to listen to and who to trust. But I'm going to say, think of this not as an 18-month time scale. I think that that's overly pessimistic. All we know about this is that at least we'll be able to see more in a few weeks, and it takes weeks for the data to respond to what you do now. So this is a word that's coming to you now. It's why I mentioned the example of Jonah and Nineveh. They had a word that something was coming, and they put off the daily activities to turn to what was really important for them, and to turn to say, buying and selling is not that important for us for a few weeks, especially if we can save some lives and if we can do what we can do to slow down this enemy that's attacking us. So that's your decision. Will your city follow Italy or South Korea? Will your state follow it? Will your house follow it? It comes up to you. And that's kind of where my faith really speaks to me. Faith does speak to your heart and your personal choices. And I'm saying here as somebody who thinks that that's the most important thing here. Scientific data can be wrong, but that's why I look at a lot of it, and I take my time to wait until the data came out today before making this talk, because I wanted to be sure hospitalizations would not go up that much. They didn't, and now I have this talk. Okay, so I want to say I'm praying about this. I'm looking at the data. I don't think that we should sell years of our lives to this theory. We don't have to. We're asking right now for weeks, and then let's come together as a people. Let's look at the data, and let's try to figure out what it's saying, because this is the world that God made for us. And these are the choices that we have. Some things we can't control, some things we can. So that's my conclusions. I have listed those at the beginning, but if you want to follow South Korea's trajectory, I expect that we can act like South Korea. We don't have to act like China either. We don't have to weld the doors to keep citizens in. What we can do is we can follow good old American individualism and make the right choice individually to say, hey, maybe I'm not so sure about the science here, but it's certain enough to be worth a couple of weeks of social distancing. And to our elected leaders, I want to say, let's make sure that we have the conversation about how well it's working and what we can do. And I am hoping that soon, in a matter of weeks, we'll be able to start to say, this is slowing down. What do we do to have an exit strategy from this? How do we phase back into regular life? But I want to say, Lenten period takes 40 days. This kind of thing takes weeks, at least. And so please consider this. Consider what you can control. Pray about it. Listen to what God's saying to you. And, He will take care of you in whatever circumstance it is. Even those of us who are making the wrong choices. I guess that's my final word. I see a lot of people that see other people that are not social distancing, and they're kind of like the elder brother and the prodigal son. They're kind of like, I'm doing the right thing, and he's over there, and you're throwing him a party. He's able to be with his friends. Don't look at them. It's not about them. It's not about their social distancing. If you're doing your part, that's what you can control. The other thing you can control is not letting your blood pressure go up because you look outside and you see all these people that are closer, that are 5 feet away instead of 6 feet away, okay? We can't control that. What I can control is I can control my words to you. And so I hope you'll listen for God's voice in creation, God's voice in his word, and consider what he's saying to you right now, because he's speaking to you and to your decisions what you can control. Okay. I'm praying for us all. This is unprecedented, but in everything that's been precedented, God has been with his people throughout things worse than this. And we don't know how bad this is yet. But there can be pleasant surprises as well as unpleasant ones, like the data for the hospitalizations. So I'll keep an eye on the data. I'll get back to you when I see something else. For now, let me know if you have any questions in the comments. And I hope that may God bless you and keep you until we can talk again.